I'll just begin by introducing ourselves. I'm Gary Hickey, and as it says on the slide, I'm a Senior Public Involvement Manager at Involve. I'll talk a little bit more about Involve in a moment. Myself, I've got a background in health and social care research, including in patient and public involvement, and also a background in organisational ethics. At Involve, I lead on two key areas of our work, which is on co-production in research and also the International Patient and Public Involvement Network, which obviously is hosting this session today. Katie, do you want to say something about yourself?
Thanks, Gary. Hello, everybody. My name's Katie, I was amused to see for the second poll that I don't actually fit into any of those categories in terms of how I describe myself, because I am actually a researcher, but I'm also working from lived experience. So I could have ticked both of those boxes, and maybe some of you could have too. I work in the Population Health Research Institute at St George's, University of London. I work, as I said, as a researcher there using my lived experience. I also have a role in the development and support of public and patient involvement in research in our department. Over to you, Gary.
Thank you very much, Katie. Okay. Right, okay, in terms of what we're going to do today, I'm just going to give you a very brief, and I promise it's a very brief background to the organisation I work for, Involve. Then I'm going to talk about the what is patient and public involvement, the why we do patient and public involvement, and Katie is really going to get into the meat of the how we actually do it. Now, inevitably, of course, it's going to be quite UK-centric because we are in the UK. So we would actually be delighted and fascinated, of course, to hear from other people about their experience and to see if we can address their questions and share all of our collective knowledge and expertise on this. Just a little bit about Involve then, the organisation I work for. Basically, we're based in the UK and we support active public involvement in National Health Service, public health and social care research. We very much regard ourselves as a centre of expertise in all things patient and public involvement, both nationally, but also increasingly internationally. What do we do? Well, we provide advice, guidance, support on patient and public involvement in research. And we do that in terms of, we publish written guidance. We have an inquiries helpline where people can email us, phone us with their queries. And of course, we lead and contribute to a number of projects which seek to further patient and public involvement in research. And Involve is part of the National Institute for Health Research, which is the biggest funder of health and social care research in the UK. Okay, so let's get on to the question then. What do we mean by patient and public involvement in research? Well, I'm sure you're all familiar, as I am, with there's a whole range of terms that you see in the literature, through from lay involvement, co-creation, increasing the patient voice, service user involvement, just to name a few. So it's no wonder, I think, that sometimes we all get slightly confused about what it is we mean. So I want to be clear with you about what we mean when we talk about patient in public involvement. And we appreciate, of course, that different countries will use different terms to describe the same thing. But what we do, we distinguish between three key terms: involvement, participation, and engagement. So by involvement, we mean research being carried out with or by members of the public, rather than to, about, or for them. So this will be, for example, patients and the public helping to design and deliver your research. For example, helping you design your research instruments, your questionnaires, your interview schedule, perhaps helping you write your research proposal. So you're not actually collecting any data from them, you're working with them on a design and delivery of your research. Now that's distinct, of course, from participation. This is where people take part in a research study. This is where you're extracting data from people as part of your research. So this is like patients who are involved in a clinical trial. It will be patients or public who complete a questionnaire for you, or perhaps you interview. And that's distinct again from engagement. This is where information and knowledge about research is provided and disseminated. So, for example, this is about patients and public being involved in writing research papers for publication, or perhaps presenting findings at conferences. Now, of course, sometimes the boundaries between these different terms, these different definitions, are blurred or they overlap. So, for example, in co-produced research, you will have patients and public involved in research, participating in research, and indeed possibly or probably in fact involved in engagement in terms of disseminating information and knowledge about the research. But I do think this distinction is very useful, so we can be clear about what we're talking about when we refer to involvement. And of course, just to stress, involvement, of course, is the focus of this webinar today. Now, there are different approaches to patient and public involvement. And on this slide, you will see three broad approaches: consultation, collaboration, and patient-controlled or patient-led research. And I just want to stress that I'm not advocating one approach over the other, but I'm going to try to outline these different approaches. And one way of distinguishing between these approaches is to think about the amount of power or influence on decision-making that patients and public might have in your research. And we can use this concept of power, if you like, to distinguish between the three approaches I have here. So in consultation, perhaps you might ask for patients' advice about how to recruit other patients to a clinical study, or your patient information sheet, or perhaps indeed your research questionnaire. But basically, you're asking their opinion, and there's no shift in power, there's no onus at all on the researcher to actually take those comments on board. You're merely consulting, you're asking an opinion. That's distinct from collaboration, where this is much more a partnership approach. So perhaps a patient becomes part of a trial steering committee, where they'd have an equal voice to other people around the table on that committee, be it researchers, practitioners on that steering committee. Or perhaps you might ask patients to help design your questionnaire. And of course, their views would have equal weight to yours as a researcher as part of that questionnaire design. So there's a real shift in power away from the researchers towards patients and public. And finally, we have patient-controlled or patient-led research. And this is where the research is under the control of patients and public. So you have a real shift in power towards patients and the public. Now, in practice, of course, distinction between these approaches is quite blurred. And in practice, we know that involving patients and public is often a dance across various approaches. So, for example, you may consult with patients and public about the design of your research proposal, but you may collaborate with them in the design of your questionnaire. But I think this is quite a useful analytical framework to help get some clarity about the role of patients and public in a research study. And I genuinely believe that that clarity is really, really crucial to managing expectations when it comes to actually involving patients and public in your research. And this is something I think that Katie is going to touch on when she talks about how we do patient and public involvement in research.